So we got started. I'd like to introduce Neel Majumder. Neel holds a Master's of Health Informatics. He is currently a senior leader in the Office of Virtual Health, Provincial Health Services Authority, where his work focuses on virtual health products, development, and digital health analytics. He has been engaged in implementation and change management for a variety of health information systems and virtual care solutions at some of Canada's largest academic healthcare organizations, including the University Health Network in Toronto and North York General Hospital. And he has acquired through this work competencies in business analysis, project management, process reengineering, artificial intelligence, and technology implementations in the area of complex virtual healthcare solutions. So with that, I would like to pass it on to Neel to talk about virtual healthcare trends and drivers.
Sorry, I just trying to find my unmute button. It was hidden in the second screen, as you know. Thank you, Andre, for the introduction. I'm glad to be back and glad to see you as well. Thanks everyone really for joining the session this afternoon. I really wanted to do a kind of an introduction roundtable with you all, but I don't think we'll have the time for that. Maybe we will have some open time at the end for a kind of chat and really discussions on the topic that we're going to talk about in this session today. So I have got a slide deck which will really help me guide through the talk that I planned, and then at the end we can take some questions or comments that you may have on these topics. All right, so this is the plan for the talk today. Is kind of, as you know, we are talking virtual healthcare for lunch today. So this is what I thought would be really a good summary of what we can do in the next hour. So we are going to start with few adoption insights about virtual healthcare. So as you know, there has been a growth spurt in the virtual care at the start of the pandemic. So it would be interesting for us to really understand and see, did it really sustain, the growth spurt really sustain as we have hopefully left the pandemic behind us. And we are going to see some stats and numbers which is coming out from the Office of Virtual Health, since we deal with a lot of data related to virtual health visits. And also I'm going to kind of point to some resources which are out there in the public domain, but which also talks to some of the adoption insights as well. And then kind of the second part is really we are going to go a little bit deep into the key drivers of virtual health. What really drives the adoption of virtual health? Only because being part of the Office of Virtual Health, so we get to talk to a lot of patient partners who has really kind of experienced virtual care, and also we really collect a lot of data related to the virtual care. So we do have some insights around this space as well. The third one is we are going to talk about the virtual health spectrum kind of. So is virtual health really kind of doing an audio video call or doing a Zoom chat with your doctor, or is it something more? So what does the spectrum hold for us? How does the continuum of virtual health look like? And also we'll touch upon some of the key trends based on the continuum and the spectrum. Number 4, we are going to talk about the virtual health barriers. What are the key hurdles, right, from patient as well as the provider's standpoint? And this is based on the data and really understanding of the Office of Virtual Health, since we really collect a lot of feedback from the patients who are accessing virtual care. And also we'll be happy to share some of the success factors, which I think are lessons learned being part of the virtual care domain for a while, and also from the Office of Virtual Health. And at the end, so I'll be happy to also share some resources that the Office of Virtual Health the incredible team there has really worked on. So these are some resources which are out there in the public domain. People can access it, but I'm going to walk through and kind of so that we have an understanding of exactly what does Office of Virtual Health do and how are we really helping accelerate virtual care in BC. So yeah, so this is the plan. And moving on here, so just kind of wanted to start with this only because at times there is often a lack of clarity when you talk about virtual and digital health. So I couldn't really find a better explanation than this onion graphic out here, because this really sums it up all. And when we are talking of virtual care, it is really a subset of digital health. So digital health is really the overarching term, as you all may know. And then when we are talking of things like AI in healthcare and virtualized clinical trials, so this slightly falls outside the domain of virtual care, and more so it's pointing towards digital health. So this is just to set the context, and most of the talk that I'm going to do in this session today will be based on the three initial rings that you see. We will talk about telehealth, telemedicine, as well as virtual care. So yeah, and moving on. So this is starting on to the virtual health adoption insights. So early 2022, the Office of Virtual Health commissioned a study, and we actually partnered with a health informatics expert to really understand the benefits and impact of virtual health visits. So what came out is the statistic that you see here on the screen today. So it seems like 1 million visits in BC really has saved over 800,000 hours of travel time and 22 million kilometers of travel. So which is also reduced the carbon footprint by 8,000 tons. So really the crux here is virtual health is not only good and beneficial for the patient, it is also kind of good for our planet as well. So this is based on the data from 2021. So I'm sure we'll have the numbers will increase much more when we are working on the 2022 data. So the team is working on right now. Maybe at some point of time we'll be able to do a public release of that. Yeah, so this is these are some other numbers which also help us really understand the adoption of virtual care in BC. So as you all may know that Zoom for Healthcare is the platform which has been endorsed by the government of BC and the Provincial Health Services Authority to conduct virtual health visits. So most of the virtual health visit consultations, at least on a provincial level, is happening through Zoom for Healthcare. So our team, the Office of Virtual Health, was really responsible kind of for tailoring the actual Zoom solution to make sure that it is fit for use for the healthcare purposes, just to ensure all the security and privacy standards. So they were the team that rolled out Zoom for Healthcare across all the health authorities. And this is very widely being used now across all health authorities. And in terms of the consultations, in a span of 2 years, which is, I think, slightly more than 2 years, March 2020 to September 2022, we recorded 2.2 million virtual health visits. That is across all the health authorities combined. And also will say that this doesn't include the private virtual health visits like platforms like TELUS and CloudDX. This doesn't include that. This is only from the provincial standpoint, the statistic. And in terms of the clinician users of Zoom for Healthcare, so we started with, I think, 7,000 users at the start of the pandemic, which is, I think, April 2020. But now we have 41,000 clinical users using the Zoom for Healthcare platform. So these are really some good statistics to understand kind of virtual here. Health is really here to stay, and we have maintained the growth spurt that had happened during the pandemic. So the 2.2 million virtual health visits that I was talking of in the previous slide, this is a breakdown of kind of the virtual health visits by the health authorities. So Vancouver Coastal Health recorded the highest percentage, and then PHSA, and then Fraser Health. So although we have not yet commissioned an a research study to really understand the cause of this distribution. What we have heard and seen is that these numbers are, means there are various factors that are impacting the adoption of virtual care. It may be accessibility, it may be population density, it is the kind of care that we kind of give. If it is really primary care, the virtual care adoption is much higher compared to the specialty care. So all those factors are built into this number, but hopefully at some point of time, we will really commission a research study to understand the underlying causes of the factors behind this. So yeah, and moving on here. So this is, so we do, the Office of Virtual Health also does an annual survey for the patients using Zoom for Healthcare as their virtual visit platform. So these are the data and some of the insights that we got from our survey results in 2021. We have the same kind of infographic that is a work in progress right now for 2022. So this is not yet out to the public, but this might give us a feel and understanding of exactly what's the response of virtual care has been in BC. So as you can see the numbers out here, so it's pretty encouraging. People were happy accepting virtual care. So they were really happy with the audio and video quality of Zoom as well, which was a concern for us. And also they were pretty okay with the kind of set of instructions that were given at the start of the virtual care visits. Although having said that, there are also some areas of improvement that we identified, which I'm going to do a deep dive maybe at the later part of the presentation when we talk about the barriers. But this is just to give you an highlight of what patients are feeling about virtual healthcare here. The next one, yeah. So this is a similar infographic just provided just on the clinical provider standpoint, and the impression is more or less the same. They were also really happy with the introduction of Zoom for Healthcare as a virtual visit platform. Some of them really agreed that it even reduced the transition time between patients. So this was a new learning for us, that it even helps in the coordination of care, and it helps to efficiently allocate the time for our healthcare teams as well. And also there are some top reported barriers here, which we will talk about in our barriers section. So this is the next one is really, if we move away from BC, and this is these numbers are also an impression of how virtual care really stood out in the country. So these are some statistics from Health Infoway, the surveys that have been done, and people have really adopted virtual care. People are willing to experiment and try more virtual care when they access healthcare services. So this is just to give up these numbers, in fact, reinforce the fact that virtual care is mainstream across the country as well. Okay, and this is an interesting graph which I wanted to share here. This is exactly the point where the growth spurt happened, when the start of the pandemic and people were really scrambling for any systems and solutions that can enable them to really talk to the doctor, be it phone, be it any other platforms. But the important thing is that BC has maintained a pretty good pace right from there. So there has been mostly upsticks from there, and it has really sustained the growth. And some of the reasons, though it is not backed by research and data, but some of the reasons while we see this graph here may point to the fact that means the access to family doctor for people in BC are quite restricted. So they found really virtual care a very good option to access healthcare timely as well. Okay, and next one. So kind of if we really move out from Canada, so I had a brief consulting opportunity with the government of India's national telemedicine platform. So they are in fact the world's largest publicly run telemedicine platform. So I just wanted to share with you some of the lessons learned with my very brief interaction with the team out there. So it's a completely government-run model out there. So it is built, managed, and maintained by the Government of India Health Informatics Group. So it was rolled out in November 2019, and from that time, I think these are the statistics that you see very recently. So they have served more than 92 million patients, and they have enrolled a lot of healthcare centers also into that network. So really, some of the key learnings are where that they operated on a hub and spoke model. So the hubs were really the academic care centers, and the spokes were the kind of lower tier centers, maybe primary or secondary care centers. So the hub functioned as really the resource centers, or kind of the specialist center who were really giving the telemedicine services to the spoke. So that kind of model really worked well in a landscape like India. And also they wanted to address a large section of the population who didn't have access to internet or even kind of any technology infrastructure that we need to access virtual care. So to address that, so the fourth point here in the slide is they established some common service centers. So common service centers are really centers, maybe kind of an internet cafe, which will have really the technology that you need to really do the virtual visit with the doctor. So they established thousands of that, mostly in rural areas, just to include more and more population across. So and this has worked really well. So this is something, an interesting fact to know when we are talking of virtual healthcare here. Yeah, all right. So what's happening in the US? So these are some reports that also say that there has been a significant adoption of virtual care in the United States. The adoption is relatively more in urban areas than the rural areas. And also, one of the interesting facts that came out of the report from McKinsey was that after the pandemic, 2 years down the line from the pandemic, there is really an uptick in the behavioral health virtual care space. So this is virtual care adoption has proven to be highest for mental health and behavioral health specialties. Whereas for other specialties, it has kind of come down a bit after we have moved on from the pandemic. But this is an important observation for us when we are talking things and insights about virtual care. Yeah, so kind of as we have seen, really some of the key insights around BC, the Canada, and internationally. So virtual care is really becoming mainstream, and this is due to a certain number of key drivers of virtual health. So I've got a list of the drivers that we have identified while based on the feedback from the patients, from PHSA patients accessing virtual care, and also from a lot of reports which are out in the public domain. So yeah, so this is in a nutshell, in a crux. So I know there may be plenty of factors which are driving the adoption of virtual care, but these are some of the key ones that really stand out in all the reports, surveys, and the feedback from our patients. So from the patient standpoint, it's very imperative that virtual care has given an expanded healthcare service. So as we know, and it's pretty common for us that lots of people in BC and across the country do not have access to a family doctor or a GP. So this is virtual care has given them the real option and the solution to the problem. So, and also efficient and cost effective. So as I shared in my first slide, so we are really clocking the time savings and also the money savings from virtual care visits. So this is really saving time and money for the patients, and also increased convenience. This in fact was rated as #1 and top reason for patients to use virtual care in the future times. So which I'm going to show in the next slide here. And now, really from a care provider standpoint, yeah. So as we heard from the team who are using the Zoom for healthcare at PHSA, they are very happy with platforms like Zoom. So they think that this is a really an effective platform to kind of provide virtual care. And also there is a good impression on even kind of doing audio calls with the patients, and also secure messaging and emails. Improved care coordination. This is also what we learned from the Zoom survey that we did with our patients. So the healthcare teams, the healthcare provider teams have in fact reported that due to virtual care, they have seen a reduction in the transition time between the patients and improved clinical outcome. Although there are many studies out there in the world which has shown that virtual care in fact is can lead to improvement in clinical outcome. I've got one case study to show which I was a part of during my time at UHN. So yeah, so this is what the survey says. And the crux of this one is really the patients rated convenience as #1 reason for choosing virtual care. The other reasons is kind of shorter wait times, and because my doctor told that virtual care is good for you, and also cost savings and time savings. So these are the key reasons that people are really adopting virtual care. And so, and some of the reasons that will make people likely to use virtual care are ease of use, and really if we are able to address some of the privacy and security concerns. Yeah, so this is from the patients, and this is these are some statistics from the provider standpoint. So an interesting thing to note out here is a lot of virtual visits are still now being conducted over phone. It is just like a phone call between the patient and the doctor. So that is really the large volume. And there is also a significant amount of video visits happening, like the Zoom for Healthcare platform. But there has not been much movement or traction in the area of patient monitoring or the remote patient monitoring area. So that is an area which is really picking up and coming up in the future times. And this is one of the trends that we have seen, that people asking for more remote patient monitoring options. In fact, OVH will also, we are partnering with the province to launch a province-wide remote patient monitoring system, which may be launched, I think, a few months down the line. So that's what is happening. So yeah, and one other insight also from all of this nice looking pies here is there is also a demand for asynchronous care. Kind of people also want some care over email and text. So that also addresses some concerns over language and also cultural barriers that has been reported by patients who have used Zoom for healthcare. So this is also something which is good to know. And yeah, improved care coordination. So this has been reported across, I think, the last 2 to 3 years. So virtual health visits has really reduced the transition time between patients. So the data that you see here on the slide is for 2020 and 2021. So we are hoping to add a third layer of 2022, maybe a few months down the line, which we expect will be in the same lines. But it is a good learning for us that care coordination has really improved due to virtual health visits. Yeah, so this is a case study that I was talking of. So while at my time with UHN and with the Department of eHealth Innovation, so there was a remote patient monitoring system launched, which was the name of Medley. As some of you may have already heard, it's pretty widely publicized. So this is a heart failure self-management program, and this has 2 components to it. One is the app, and one is the kind of the systems and the people around it. So it is really that Medley, which was a good combination of how we can integrate virtual care and remote patient monitoring. And this has been proven in a study that was done, I think, a few years back. So it has been proven that the numbers that you see here in the slide, 50% reduction in the number of heart failure hospitalizations and 24% reduction in the hospitalizations for any reason. So the uptake, so I was part of the kind of the outreach team at Medley. So I've seen firsthand that really the uptake of this remote patient monitoring system among patients across all ages was pretty high. They found it pretty useful and convenient to kind of to know that their clinical team will be able to monitor their heart rate or any other kind of factors remotely from their home without having to travel. So that is really a good example of improved clinical outcome. All right, so we are in the third section of the presentation today. So this is the virtual health spectrum and trends. So based on what we discussed, the key drivers of virtual health. So I'm going to talk through a spectrum of virtual health that we have seen really working well for the patients, and some of the trends that has come up from there, which will be sort of defining in the future times. So this is the spectrum of virtual care. As you can see, kind of what we have noticed and we have learned from the Office of Virtual Health, and as well as from other experiences in the past, is that there are two ends to the spectrum. One is the synchronous and the episodic kind of end of the spectrum. The other end of the spectrum is asynchronous and continuous. So when we talk of audio visual appointments, like the one that we have for Zoom, like the one that we kind of just do a phone call, the doctors do a phone call with the patients. This is right at the synchronous end of the spectrum. And we are also kind of trying to experiment with asynchronous stuff, for example, here through email and text, which is not real time, but kind of really the doctor can review all the reports and results at the end of the day at a specific time and respond to the patient. And the third one, as kind of we talked about, is a remote patient monitoring. There's an increased interest of remote patient monitoring from patients across the province. And this is, I think this is a global trend here as well. And also there has been a lot of automated and AI-enabled virtual care, which we keep on kind of seeing and reading in the media these days. Lots of health apps in place, and lots of e-triaging solutions, virtual urgent care, and self-scheduling kind of stuff. So this is the group of applications which will help us automate a certain piece of the care. For example, it might be a digital front door, if you are doing uptake, if you are doing intakes, or if you're doing e-triaging. So those kind of can be really handled through AI-enabled or technology-enabled virtual care. The last two are really on the passive monitoring standpoint, or also kind of, this is more wellness related. So a lot of Fitbits, a lot of wearables and trackers are in place right now. There's a huge adoption of all of these wearables, and people are really willing to kind of do a passive monitoring of the data of their activities of daily living, which can then inform that how to lead a very healthy and optimized life. So this is coming to the other end of the spectrum. So typically virtual healthcare includes all of this. At PHSA's Office of Virtual Health, since we are serving the province, we are primarily concerned with the left hand of the spectrum at this point of time. We are doing the audio visual appointments. We are also launching a clinical digital messaging tool, CDM tool, which will kind of promote some of the asynchronous care and also the remote patient monitoring. This is what our focus is right now from the OVH standpoint. Yeah, so kind of what we have seen and learned from the spectrum is what we are seeing as an emerging opportunity. So there's a lot of attention and traction towards digital front door, kind of creating a e-triaging system, so that kind of patients do not have to travel to the hospital to get some simple triaging or simple assessment done. And there is also an automation of the patient intake process. So one of the very interesting projects that I was involved during my time at UHN was a Toronto virtual ED. So this was a joint partnership with some downtown Toronto hospitals, and UHN was the lead in that. So we had to create a a e-triaging system wherein patients can really come on and come onto the platform, which was a website, and then they can enroll and see a triaging nurse or anyone from the ED before they actually choose to come to the hospital. So that was very, very useful, and that was very appreciated by the patient community out there, because we were going through a lot of COVID challenging times, and that digital front door really gave them an option to do an really initial assessment before they choose to step out of their home or before they choose to travel to the hospital. And also on UHN standpoint, since I was a part of their team, so we also saw a lot of reduction in the number of unnecessary patients in the ED, and the crowding became slightly less. Not much, I would say. So this is still on at this point of time. There's a lot of there's a lot of systems and processes which we had to build at that point of time. So I think this is pretty on there as well. And also the next point is integrating remote patient monitoring and digital therapeutics. So this is what happened when we worked for Medley as well. This also really worked well. And some other trends, as we saw in that slide from the United States, I think McKinsey report, there is an expansion of behavioral and mental wellness virtual care models, and also demand and interest in asynchronous care. So people are also looking for offline care options. So I don't need to talk to my doctor right now for a pain. Maybe if I can get some opinion from the doctor towards the end of the day, that also works for me. So that is the kind of care that people are looking for. And also there is a huge demand of coaching, health coaching, virtual health coaching also. So these are some of the trends that we have seen in terms of the virtual healthcare. So this is some stats which also reflect the trends that I just spoke about in the previous slide. So there is a slight inclination towards virtual health coaching, virtual mental health counseling sessions. So this is what people would like to experiment with virtual care. So they have been doing this appointment scheduling, they have been doing this consultation, but going forward, they would like to really experiment with these aspects of virtual care. All right, so this is kind of a section where we are going to talk about the virtual health barriers and some of the key success factors that we have seen and learned during while talking to patients who are accessing virtual care. So some of the barriers that you see are very obvious. Kind of, in order for any patient to access virtual care, they need to have access to the right technology, or they need to have the knowledge of how to set up. So these are the key barriers that people have reported, that I don't know what to do, and the instructions were not clear to me. So I would appreciate kind of a briefing session before my virtual health starts, in order for me to have a whole understanding of how the process will go like. So all those has been feedback from the patients, and also some of the patients have also flagged a lack of technical support. So when we rolled out Zoom for healthcare across the provinces, we have a dedicated support team, and we have a tiered support structure, tier 1, 2, and 3, to take care of all this technical support. But the problem was that there were patients who said that they didn't even know that there was a technical support line, although it was kind of mentioned there somewhere in the email when they received about virtual care. So they said that we didn't know, and kind of I didn't know what to do. So we used to run these focus groups of patient partners who were really interested to partner with us to share some feedback on virtual care. So this is what we heard from those focus groups. And some of the non-technical barriers, so it was patients were having a hard time with establishing a relationship with somebody just on phone or on the screen. So that came out to be a really number one issue out there. And language barriers was also flagged out. And as you know, kind of, in order for a patient to access virtual care, so they usually do it from their home. So a lot of patients also spoke out on the fact that there was a lot of distractions going on, and it was not a private space. So these are the key things that came out from the focus group that we had with our patient partners. And this is some of the data. This is a word cloud that we have done in Microsoft Power BI, so which is a data visualization tool. So these are some of the feedback that came out from the focus group, that they wanted us as a kind of the Office of Virtual Health, who are the product owners of Zoom, to include the short video instructions, meeting reminders, and some people had scheduling issues. And some people even wanted a hard copy of instructions. And there were also patient partners who said that they would want us to include the software privacy information inside a virtual health visit. So these are some of the real feedback that we have received. And based on the feedback, we have done some changes, which I'm going to share with you in the section that we talk about the Office of Virtual Health. But this is also wanted to highlight some of the key barriers from a provider's standpoint. So somewhere in the similar lines, so access to the equipment or access to the technology was an issue. And the big issue that was flagged by a lot of physician groups was, so this virtual health visit platforms was not integrated with the EMR. So they had to do a dual documentation, and we in fact did a workflow walkthrough at BC Cancer just to understand how the patient care coordinators schedule the virtual visits. So that was in fact a very cumbersome process, because the coordinator had to switch between different systems, and it took around 20 to 25 minutes to complete that. So that is something which has been raised quite often, that if you were having a virtual health visit platform, it should be integrated with the EMRs. So and from the non-technical barrier standpoint, yeah, so some clinicians prefer personal in-person consults due to the nature of the disease or due to the nature of the patient, and some were also a little bit apprehensive on the risk of the outcome or errors, and some also raised some issues around the patient and engagement when they talk to patients in a virtual care setting. And this is also some of the graphs and data around that we really took on the feedback around the barriers. So this is also speaking to the points that I just went through. Key considerations. So this has been our lessons learned from talking to patient partners, talking to the healthcare team about virtual care, that these three always come to the top of the mind. Is whenever we are building a virtual healthcare system, be it maybe a virtual visit platform, or be it asynchronous platform, we should design it really kind of from the patients and the healthcare team standpoint. So inclusive design is something which came up, and also kind of if the virtual care also needs to be integrated with the whole continuum of care. That's number two that usually comes up when we talk to patients and other partners. So it should not create fragmented care. That's number two. And of course, as we know, right, so we need to make sure that everybody can benefit from this virtual care. So we need a really good focus on equitable design. So these are the three key areas, and of course there are much more to that, but these are something which we have learned over these years. Well, this is a pretty busy slide, so I'm just going to skip that over. Maybe I can send this slide deck to you if you want to have a look, but these are some of the KPIs that we are considering as part of the Office of Virtual Health when we design virtual care delivery models, how to really measure the success of a virtual care delivery model. And yeah, so I think we have reached the last section of the session today. This is the Office of Virtual Health. If you have not heard what we do, so I'm really the goal of Office of Virtual Health at PHSA is to promote the acceleration of virtual care. And the way we do it, that we have two different teams. One is the clinical innovation and the systems enabler team. So we work hand in hand with our partners. So we design and implement solutions related to virtual care. We also we also help our partners to design new ways of thinking. We also help in augmenting the existing solutions that are there right now. So there is a kind of a website of PHSA, Office of Virtual Health, which is embedded within the PHSA, the master one. So I can share the link if you are interested to learn a little bit more. I'm going to skip over this one. These are really the foundational pillars, the way that we work at Office of Virtual Health. Now, these are some of the artifacts that we have in place, and this is out in the public domain. This can be accessed via the Office of Virtual Health website. So we have a virtual health visit checklist for clinicians. So this really helps clinicians to streamline the virtual health visits. So this is there on our portal. This has been done by the Office of Virtual Health Training and Education team. This is pretty good for anyone who is going into virtual care. And these are some of the ways that we are trying to make virtual care more accessible. So language issue was one of the key issues that were raised, and that is the reason we have introduced the VRI. So VRI is in function across many of the sites here. So there are you can have remote interpreting options during a virtual health visit, and also captioning for your virtual health visits. This also received a lot of good feedback for patients who would really want to see what is kind of going on in the form of a caption, and interpreters for group virtual health visits. So this was also well applauded and appreciated by the patient community. So these are some of the initiatives of Office of Virtual Health, and this is something which was released very recently. So the Virtual Health Competency Framework. So the Virtual Health Competency Framework gives a very broad understanding to any healthcare, to anyone from the healthcare team who is going to understand their competencies and who is going to provide virtual care. So there are kind of 4 facets to it, and you can read this at some point of time offline, but these are some screenshots. So this is also out there in our website if you want more details on that. And very recently, I think this is a month back, we launched the digital health literacy course. This is also for people, this is also for the clinician community who want to have an understanding about the world of virtual care, some of the key languages, some of the key terms that are used while we really deliver virtual care to patients. And this is, we have just come down to the end of our presentation. I think this is 39 out of 41. So this is a new product that we are trying to experiment and innovate at the Office of Virtual Health. So Atlas, so the vision with Atlas is, it is going to be a knowledge translation and sharing platform for anyone who is being impacted by virtual care. So this will be a resource hub, and this will be also the innovation platform when we talk of virtual care. So this is we're just currently doing the product visioning and strategy based on the Atlas, but this is just to give you all a sneak peek on what is Atlas, and we are planning to launch some version of the Atlas towards the end of this year. So Atlas will be publicly accessible, and it will have all the resources and case studies and patient stories and testimonials related to the virtual care in BC. So if you want to say, for example, some of the case studies of virtual care in Prince George. So there will be a map view of where you can just click on the map and drill down to exactly a town or a city and see what is happening in terms of virtual care there. So this is something which I wanted to share with you all. This is also, so the Atlas, so the reason we are trying to bring Atlas out to the market is to really promote faster, better, and cheaper virtual health implementations. So in an implementation cycle, there are a lot of milestones which we need to do in order to ensure that we have an optimal implementation. So if we have a resource hub, if we have a knowledge repository of all the case studies, of all the resource toolkits, of all the best practices that people really follow while designing virtual care systems, that will really help anybody who is working on the same lines. Yeah, I think this is the end of my talk.